Hello, everyone, and welcome to Every Scar Tells a Story with Christina and Alejandra. We are thrilled to be here today with Amanda Grilli. Amanda is an oncology physical therapist, certified lymphedema therapist, and certified cancer coach who specializes in breast cancer rehab, helping people recover from cancer-related side effects and restore their well-being during, after, and beyond treatment. Amanda is also the founder of Well Beyond Breast Cancer, a nonprofit dedicated to improving the quality of life in breast cancer community by expanding access to cancer rehab through financial assistance, education, and advocacy. We are especially excited for today's conversation because Amanda will also be sharing some actionable scar care techniques that you can start doing at home today. Amanda, thank you so much for being here. We are just so happy to have you.
Thank you both so much for having me. I'm so excited to have this conversation, a conversation that many people don't get to have. So I'm super excited to empower your community and provide them with a little bit more education and knowledge.
This is so awesome. So, Amanda, before we get into all of your knowledge, which we are so excited about, you are very accomplished and you're doing a lot of things now, including Well Beyond. And I'm wondering if you can tell us a little bit about just who you are and kind of where you were before you started this journey
Mhm.
into this space and this work.
Yeah, it's such a good question. So prior to becoming a physical therapist, I actually worked as a surgical coordinator at a breast cancer clinic in my hometown in Montreal. And it was during my time there that I met with everyone who was newly diagnosed. I would see them and I would work alongside the oncologists and the breast surgeons to plan their treatment plan. And it was really during my time working there that I realized that so many breast cancer survivors experience a whole slew of side effects from pain, chest tightness, limited mobility, radiation fibrosis, and so many other things. And yet no one was helping them to address their side effects. And that really didn't sit well with me. I saw people lose their independence, lose their sense of self, lose their ability to participate in their daily lives. And so I decided, okay, I'm changing my career path. I'm going to school to pursue a degree in physical therapy with a specialization in breast cancer rehabilitation. And I've been working in this field now for over 10 years and I've never looked back. It is incredibly rewarding and it's such an honor to be able to work with this community.
That is incredible. And I just have to say, I didn't even know such a degree or a course of study existed for breast cancer rehabilitation. Obviously, Christine and I, this vibes with us. Like after every surgery, no matter how minor, I feel like some rehab is needed. And the fact that there's something so specialized and now you're the expert in it is incredible. So I'm very excited for you to share some of your knowledge and experience with us. Thank you.
Yeah, definitely. And I mean, like you said, not many people know that this is even a specialized field of physical therapy. People know about orthopedics, they know about neurology, they know about pediatrics, they know about pelvic floor now, right? Your postpartum, prenatal, you go to see a pelvic floor physical therapist, but no one has heard of breast cancer rehabilitation. No one even knows that us physical therapists and occupational therapists exists. So I'm really excited just to spread that through your podcast and making
Yeah.
more people aware because that's a big problem that I continuously I'll see people who are 5, 10, 15 years post their treatments and they're still living with chronic side effects and no one told them, hey, there's someone out there who can support you and help you move forward. So hoping this provides a little bit more education for the community as well.
This is
Wow, this
awesome.
is amazing. I have two. I mean, we have a list of questions that we want to get into and we're very excited about them. But I have two questions that I want to ask you right now that are separate.
Yeah.
How do your patients find you? Like, is it through doctors or how do they, because there's so little knowledge, how do they come across someone that can help them with this?
Yeah, so there's kind of two routes. So one route is they will be referred. So there are wonderful oncologists, breast surgeons, radiation oncologists out there who look at the whole person and will refer their patients as soon as their patients are saying, "Hey, I'm experiencing X, Y, and Z. What do I do for this?" And so people will be referred proactively, or unfortunately, a lot of people just find me online, word of mouth, Google. Awake at 2 a.m., Googling their symptoms. Like I said, maybe they're 5, 10, 15 years post out and they just stumble upon my page. I mean, just yesterday, I had a phone consultation with a breast cancer survivor who's 13 years out and is still struggling with chronic pain, limited mobility, and as a result, she cannot play with her grandkids. And she found me on Instagram. That's heartbreaking to me. That shouldn't be the place where people are turning to find solutions, but unfortunately it is. And that's why all of us provide education online. But there's such a lack of awareness for this field, and that's why I'm trying to use my voice to really just spread more awareness, to really help people connect with therapists, even within their own communities.
Wow. A quick follow-up question. Do you think are there not many therapists that do this? Is that another issue? Is that it's such a small field?
Exactly. So it's a really small subspecialty of physical therapy and occupational therapy. So there's not many of us therapists. So for example, when I was working in New York City, we were 10, less than 10 for the entire city. So you can imagine that
Wow.
Yeah.
creates such a barrier for geographical accessibility as well.
Hmm.
So it's definitely a big issue and something that we're working really hard on at Well Beyond Breast Cancer. Like you mentioned, we're trying to really expand this service, whether it's through awareness, but also helping to bridge a lot of these barriers.
Well, anything we can do to help expand, we are so excited to have you
Hmm.
here to spread the word. I did have my second question because you mentioned it twice now. If someone is recovering or still feeling side effects 15, 20 years later, can that be fixed or can that be helped
Yeah,
that
so
much time afterwards?
it depends on what their side effects are. Absolutely. So for example, that person who's experiencing chronic pain and poor mobility, they just were never provided with any guidance whatsoever. And because of that, and 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 not their fault, that created a lot of fear of movement. And so in assessing this person, I see the different things that are limiting their movement, and those are things that we can absolutely be working on, such as poor upper body flexibility, scar tightness, scar pain, scar sensitivity. That's limiting her ability to lift overhead. And there's so many other things that we can actually work on. So I'm very hopeful that this person will be able to improve a lot of their overhead reach and making them more functional in their day to day.
Wow, that's amazing. That must just, I mean, I'm sure when she spoke to you, she must have just finally, for the first time, felt hope, which is the best gift you can give. We talk about this often also with Estes because people that have scars that are 10, 15, 20 years old think that it's too late to do anything. And we always say it's never too late. You can start now. You can start now and you can start to feel your scar get softer and more mobile and the tissue softening. So this is kind of the perfect segue to get into that because we are here today to talk about scars. When you are working with your patients and they're struggling with mobility or they're struggling with a sensitivity, first of all, I kind of want to break it down a little bit before we get directly into scars. What are the things that you look at that are usually causing these symptoms?
Yeah, so it depends on when that person comes to see me in their continuum of their cancer. So some people come to see me during chemotherapy, and there's certain things that I'll be looking for at that moment in time. If people are coming to me after surgery, then I'm really taking a look at how are they moving. So I take a look at their upper body mobility. I'll have them do some shoulder movement, some elbow movement, neck movement, upper back. But I'll also be taking a look at their skin. I wanna see how their skin is healing, so I visibly look at the area. All my appointments are in private rooms, safe rooms, so I
Yeah.
visibly look at the area. I take a look at how that scar is healing because as we're gonna talk about, how a scar heals plays a big role in someone's day-to-day comfort, their movement, and their function, and their overall quality of life. So I take a look at a scar, I assess how it's moving, I assess how it's healing. And I'm also looking at in the area, whether that's the scar, but also surrounding connective tissue, muscle, and just getting a better idea of all of the structures that have potentially been affected. Now, if this person also did radiation therapy, then we know that radiation causes even more tightening in the area, which we call fibrosis. So I'm really looking at the integrity of the skin, trying to feel and see if there is any fibrotic tissue in the area that needs to be worked on. So looking at the person from a whole, but really addressing those specific things.
You're like looking at how the scar moves. Are you like physically, like if this was a scar,
Hmm.
you're like
I
seeing
look,
if it'll wiggle around? Like my skin wiggles. Are you seeing if it'll
yeah,
wiggle around?
such a good question. So I look at it in kind of two ways. So I look at it in a static position. So again, I'm looking at the scar and I'm feeling it. I'm touching the scar. I'm assessing if there's what we call adhesions, which are kind of sticky points. So after surgery, right, we have an incision and our body lays down collagen to close the incision and create a scar. Well, that's a natural part of the healing process, and we want that part to happen. But sometimes what ends up happening is those collagen fibers actually stick to the layers of tissue underneath the scar. So they might stick to the muscle or connective tissue. And what happens when it does that is that it creates these sticky spots. That's what I like to call them. They're known as adhesions. And when adhesions develop, they can limit the mobility of a scar, but they can also cause all of the layers of tissue to stick together. And so when that occurs, if that person then tries to lift overhead and their scar is anchored down because of those adhesions, they may feel tightness or they may feel like I can't even lift my arm because something is pulling me from underneath. So I'm using my hands to assess if I feel any of those adhesions. But then I'll actually have my patient sit up exposed and I'll have them do overhead mobility, some different movements, and I'm looking at how the scar is moving. Is it even moving with them? Or is it staying bound down and pulling them kind of like the other end of like a tug of war rope, like it's pulling them
Mhm.
down? Then I know there's definitely something that needs to be worked on, and that is potentially limiting their mobility. So, yeah, looking at it from both eyes and hands on.
So interesting. Thank you.
Well, this leads me to my first question, which I can't wait to dive in. My first question is, if a patient is here, and let's say it's the patient that you just had the consultation with, how would you have your patient go about managing scar pain and sensitivity,
Hmm.
if that's what she's complaining about?
Yeah, it's such a good question. And I think that this is something that's not talked about enough. And people just think scars are supposed to be painful and sensitive. And yes, that's common, but we can absolutely work on that sensitivity and work on that pain. And if your scar is painful and sensitive, it's just your body's way of telling you that it's still protecting the area, right? Like I mentioned before, tissues are healing. But we need to remember that it's not only tissues that are healing, it's nerves that are healing as well. It's these superficial nerves that have maybe been cut, damaged, irritated during the surgery, and those are healing as well. And sometimes our brain can have this protective reaction and where it's misinterpreting light touch or water or temperature or our clothing sitting on our body as painful. So it's misinterpreting this stimulus that's not supposed to be painful as painful because our body's protecting ourselves. And so, one of the most effective ways that we can reduce sensitivity is by a technique called scar desensitization. It sounds crazy, but it's very, very basic. And essentially, what it is, it's a gradual, structured way that we're helping to normalize these nerves. And really what it is we are slowly introducing different textures to the area in a graded way. So we're starting with softer textures and then working up to rougher textures to really retrain the nerves over time. So what does that mean? What does that look like? I'm sure you're
Yeah.
wondering. So essentially what it means is, say I have a patient who has so much scar pain and sensitivity. Well, sometimes that scar pain and sensitivity is actually also around the scar. It's not just
Mm-hmm.
on the scar, but it can be around the area, right?
Mm-hmm.
And so what I'll start with is let's start around the area and slowly work towards the scar, which is
Mm.
usually the area that's most sensitive. And so we start with, like I said, the softest fabric. So we can pick a cotton ball, for example. And what we'll do is we'll gently rub the cotton ball in the area around the scar, not on the scar. And we introduce that cotton ball so slowly in the area around, maybe for 20 seconds, 60 seconds. It can feel uncomfortable, but it should be tolerable. It shouldn't be painful. And so they continue to do that over days, maybe over weeks. And as that gets comfortable, they move closer to the scar and eventually work on the scar itself with that cotton ball. Continuing in that same way. As soon as the cotton ball becomes comfortable, then we introduce a rougher fabric. So maybe next we pick a cotton And we do the same thing. Maybe we start on the outside of the scar and we work our way in slowly onto the scar. And again, when that becomes comfortable, we then move on to a rougher fabric such as a towel. And we continue to move through this sequence slowly, progressively. It takes time. Nerves take a lot of time to be retrained.
Hmm.
And so we move slowly working towards rougher fabrics until that scar is no longer hypersensitive anymore, until our body is retrained to say, okay, none of these stimuli are actually painful. So let's not elicit pain now. So it's a gradual process. And like I said, it takes time. Some people will move through this sequence within a month, some take a few months. Everyone's body is different. And so just making
Hmm.
sure to respect that timeline is so important. But equally as important, like I mentioned before, is we're not pushing into pain. We're working slowly into that. Okay, this is a little uncomfortable, but I can tolerate it. And then that's kind of the indication of when you know to progress.
Wow, that is fascinating.
I know. I feel like it could be a philosophy on life, like trying any new hard thing, really. That's like the
Yes.
psychology behind that is amazing. It also oddly reminds me of allergies. Like when
Mm,
you're allergic to something, right? Your
Hmm.
body's overreacting and you can do, what is it? Whatever, allergy
Yeah, you
shots.
slowly, or you can like introduce. I mean, my daughter's
Right.
allergic to eggs, so I have to like introduce something that's
Mm-hmm.
like baked, then something that's like, you know,
Yeah.
been sauteed or something. I don't
exactly.
know. Wow, that is fascinating. I so clearly remember after my surgery that feeling of thinking that when I put on my shirt that it hurt. And people asking me like, "How can that hurt?" And I was like, "It hurts. It hurts. I can't have it on."
Yeah.
I remember that so clearly, and it never, I mean, until you said it right now, it never
Mm-hmm.
crossed my mind that it was just a neurological response for the most part. I
Yeah.
really just thought it was hurting me.
Well,
Yeah.
Christina, we talk a lot, me and you, about how scars come from pain. Like anytime the skin
Mhm.
is severed, it hurts. So you already have that painful association. And like for me with my C section, I didn't understand that it was a scar for a long time. Like emotionally, I felt like it was still an open wound or that it could reopen, like
Mhm.
so it's interesting because I always associated that pain at the beginning, again, not with the neurological or just the biological way that your body's working, but I just assumed it was like me holding on to the pain of the actual incision and wound and not emotionally being ready for the scar part.
Yeah, it's such a good point because so many people believe that their scar pain is in fact related to the fact that something's wrong. Something must be wrong with the underlying tissue. It must not be healing. But it's exactly that. It's your body has been through something traumatic. It's surgery. Any type of surgery, whether elective or not, is traumatic. And your body's trying to protect you. Your nervous system is trying to protect you. So as this area heals, your brain's telling you, be very careful. Everything's going to be painful. And it's just about rewiring those nerves.
Wow, you're really sending me back to like the months after my surgery. I remember those thoughts and feelings so well. I
Mhm.
wish I had known about scar desensitivity. Because I
Mhm.
definitely would have done that. So, if someone comes to you and they have sensitivity and scar pain, especially right after their surgery, you go through this process that can last a month, sometimes multiple months. Have you ever come across someone who is afraid to go through this process or even afraid of looking or touching at their scar? That was a big thing that both Alejandra and myself went through. I never wanted to look at it. I was afraid to look at it. I eventually started touching it because I wanted it to look better so that I could look at it. What happens when a patient is afraid of their scar, afraid to touch it, afraid to look at it?
Yeah, it's such a good question. And so many people are afraid to look at their scar or touch the area. It's interesting because I have people who will tell me, I I don't want this to sound dramatic, but I'm really scared. And I'm like, it's not it's not dramatic. Of course you're scared. A scar isn't just your skin, right? It represents a surgery. It's trauma, pain, maybe survival, loss, cancer. And then it comes with a whole slew of weird sensations. Tingling, numbness, Tenderness, tightness. Of course you're afraid. Of course you're scared. That's a natural response. And so it's totally normal to feel like that. And what I try to tell my patients, it's not weakness. Don't ever think that it's weakness. It's really just your nervous system telling you that the area needs to be protected. And so a lot of the times when my patients are fearful, yes, we'll work through that desensitization protocol. But the number one thing I'll try to have them do is we'll take a step back. And like I said, instead of starting to touch around the area, maybe I just ask them, okay, let's see how you feel. Just putting your hand over the area gently, float. How does that feel emotionally? How does that feel physically, right? Because sometimes those are two different responses. Physically, it can feel, okay, this is painful. Emotionally, it can bring back so many different emotions, as we talked about, with fear being one of them. And so I usually start at that point. How does it feel just putting your hand there? How does it feel to have my hand there? And that's the number one place that we start to work before we even jump into desensitization if they're fearful.
Hmm.
Sometimes also, like I keep mentioning, our nervous system plays such a huge role in our fear, right? We have our fight or flight system, rest and digest. So sometimes before I even have my patients, okay, touch the area or do some desensitization work, I say, let's do some breath work to really just help minimize that fear, minimize that fight or fright response, and really just get you in a better mindset to then be touching the area. And one of my favorite breathing techniques to really help with regulating our nervous system is box breathing, where we
Hmm.
inhale for 4, hold for 4, exhale for 4, and then hold for 4. It's such a nice way of helping us to minimize that nervous system, but also feel more in control, right? If we're more in control of our breath, a lot of the times things don't feel as scary. So I'll often start there with my patients as well. And then if I have patients who are fearful because they're worried that the wound will open up, the incision will open up, well, then I explain all of that to them, where because we're working on it now, we've made sure that their scar is completely closed, that if there's no way that it's going to open at this moment in time, we've gotten clearance from their surgeon. So providing so much education and support, but it's all individualized depending on where that fear really stems from.
You're making me laugh. I'm
No,
laughing
I was
because
going to
I was
say,
like,
Alejandra,
really,
say all your things.
for so long, I was like, my organs are going to spill out of my body if I move the wrong way. And I remember going to my doctor and my doctor being like, it's okay, you can take baths now. And I didn't even realize that I was shaking my head no. And he was like, you're shaking your head no, but I'm saying yes. And I was like, the water will get into my organs. I was like, it'll soak in there. He's like, no. But it was just like subconsciously in me that this was like not a safe space, that it was still wide open, that the wound was still very active. And even when he's telling me it's fine, my body was like, no, it's not fine. No.
Yeah, that flight or fight.
Hmm.
They're such real fears, though. They really are. And you don't expect it. It's one of those things that you just don't know. And then no one tells you that you're going to feel this when you go into
Hmm.
surgery,
Hmm.
that you're going to feel this sensitivity and tingling. No one tells you that you're going to be scared of the area. So it's very confusing when you come
Hmm.
out on top of what you've been through.
Something else. And then trying to take care of yourself in addition to trying to heal and move, right?
Hmm.
There's a lot that no one really prepares you for after surgery.
I
Hmm.
I'm thinking through your process, and you go through the protocol, and let's say someone gets to the point where they feel comfortable with, what would you say is the most rough fabric that you would put on their scar?
It really depends, but it can be kind of like a one of those bamboo loofahs. It can be as rough as that, right? Because people are using that.
Oh.
Some people use that within the shower. So it can be as rough
Hmm.
as
Mhm.
that if that's what they like to work up to. But sometimes we
Mhm.
don't even need to work all the way up to there. After a while, the nerves are able to retrain, and then there's not that that kind of dysregulation of the nervous system. But sometimes we work up to there because that's what they use to shower.
Hmm.
Okay. Okay. So it's like very personalized depending on
Yes.
what you want to use on your. So at what point do your personal fingers come into the mix? Is it part of the protocol, or is this after you've gone through the whole protocol?
Yes,
Because
that's a
as we
great
know, Scar massage is very important, and I want to get to that,
Exactly,
but we need to
exactly.
talk about our fingers touching our scar.
Totally, exactly. So desensitization and scar massage are really two separate things. So like I mentioned before, scar desensitization is really helping to retrain the nervous system. This is a technique that we use if the scar is painful, if the scar is sensitive. Now, scar massage, totally different. It's a gentle, hands-on techniques where we're using our fingers, as you mentioned. And the purpose is to really mobilize the tissue. As I mentioned before, there's these adhesions that can develop, these sticky spots to develop, and scar massage addresses those sticky spots. So, desensitization for scar pain sensitivity, scar massage for scar mobility adhesions. So, two different things that a lot of people will end up doing both because a lot of people do have scar sensitivity to begin with. And scar sensitivity desensitization, we can usually start about 2 weeks after surgery with working around the scar. Of course, we wait till the scar is completely closed to touch the scar itself, but around the scar, we can absolutely start doing desensitization work around. Scar massage, we wait until the scar is completely closed and we get the surgeon's approval. It is different for everyone, but usually happens anywhere between 4 and 8 weeks after surgery. And so this is where we're using our fingers to really
Mhm.
massage the scar to help break down those adhesions so that the scar is no longer stuck. So like I mentioned before, if a scar has these adhesions, it can cause a lot of tightness in the area. It can limit someone's mobility. It can lead to more sensitivity essentially if that scar is not moving well. But it can also cause swelling in the area that's persistent because that scar can create a roadblock in the lymphatic system and lead to more heaviness and fullness in the area. So that's where scar massage comes into play, really focusing on mobilizing the tissue.
Should it be painful?
Scar massage? No, never. So scar massage needs to be it needs to have a certain amount of pressure, but that pressure is light. Again, it needs to be tolerable. Some people will feel a little bit of discomfort with it, but it should be tolerable. If it's painful, that means you're applying way too much pressure. And if it's painful because the nerves haven't been retrained, then we need to move
Mm.
back to desensitization. But
I'm just imagining, like, I have a sticky spot in my scar,
mhm,
and, like, obviously, I am not a scar mobilization person, but, like, I can't unstick it, and I feel like to unstick it, I would have to push really hard. Like, how do you? Because I'm imagining you're actually, like, breaking up the collagen.
you're mobilizing the tissue so that it's breaking down those adhesions, but you really don't need a lot of pressure to do that. Sometimes, depending on where a scar is, depending on how many layers of tissue the scar went through, for example, like a C-section, that is a scar that goes through many, many different layers. And so that scar will actually have adhesions that are quite deep down. And so the mobilization techniques that need to do on that scar are definitely much deeper, let's say, than a scar that's more superficial. And so the scar pressure that you use will definitely change depending on where the scar is, how far along it's been since that scar developed, but it should never be painful whatsoever.
So do you do, and I want to get back to how you introduce people to actually touching their, and my question is, do you do the massage yourself and then have your patients do it themselves at home? And bringing this all up is because we've spoken to a surgeon who has advised us throughout our entire development process of ESTAs. And he told us how important it is to touch your own scar specifically, like your finger, rather than your therapist's fingers. So I'm trying to close the loop here on how you get your patients to feel comfortable touching their scar. And then I do want to go into how you teach them their massage to do at home, if that's
Yeah,
something that you do.
yeah. So I love that. So I completely agree. Scar massage is such a beautiful way for you to reconnect with your body emotionally, physically. It's something that I teach all of my patients, and it's often the missing link to a lot of people's recovery. We often forget about the scar. We think about everything else and we forget about the scar. But like I mentioned before, a poor scar, a scar that has poor mobility can lead to tightness, limited range in the area, and so many other side effects, right? And so teaching them scar massage is something that's so important. So for that first appointment that I'm saying, okay, today it's time to introduce scar massage. We've maybe done some desensitization work. I will start with doing scar massage on them first because, like you guys mentioned, a lot of people are just fearful. They don't know how much pressure they should be using. They don't know how it should feel. They don't really understand what it looks like, right? So I will give my patients a mirror, the area is exposed, and they watch me do scar massage. And I walk them through the three techniques that I show them. And so they see me doing the scar massage, they see my amounts of pressure, what I'm doing, and they feel it. And then I say, okay, I'll have you try. And we walk through those same three scar massage techniques that I'll show you guys. And they do it in the office with me. And then that's their self-care at home that I ask that they do daily as a part of their routine to help with the healing of their scar, but to also help with reconnecting to their body. So, so important.
Wow, amazing. So you will show us some of your
Yes.
techniques?
Thinking logistics, okay? Because like I am your like typical worst patient, probably. Like my organs are going to fall out of my body. I'm terrified of my scar. I don't want to touch it. I don't want to look at it. I don't want anyone else to touch it. How much? So, say it's like a scar on one breast. How much time is someone? Because I already don't want to do it. I already don't want to touch it. And then if you're telling me I have to do it for like 10 minutes, like that
Mm-mm.
would make me nauseous. Like how much time should I be touching my scar at the
Yeah,
beginning?
such a good question. So that depends on how they feel emotionally and physically to their scar. So the goal is to do 1 minute per technique. So 3 minutes a day, not longer than that. We don't want to do too much either, right? We don't want to cause hypersensitivity. We don't want to overwhelm the area. But if I have a patient who says, and I have so many patients who say that, I'm not touching this makes me nauseous. Well, then I
Mhm.
Hmm.
say, okay, we'll start to do it together and we'll work on the other techniques that we talked about previously. And once you get comfortable with the area, maybe let's start with 20 seconds per technique or 5 seconds or 10 seconds. I meet the patient wherever they are, and then we work slowly together on that minute. So 3 minutes daily, and as the scar matures over time, less and less.
I
Puts
mean,
me at
3
ease. Thank
minutes.
you.
We could do 3 minutes, right?
I mean, I would probably have to start with 20 seconds, honestly, but like the fact that the goal is 60 seconds seems doable, achievable.
Yeah, but 20 seconds, 5 seconds, 2 seconds, it's a good starting place. And I think that's what's most important because a lot of the times the barrier is fear, that emotional aspect be tied to the scar, which is so, so normal. And it's something that we can absolutely work on together, helping them to get to whatever their goal may be, right?
So let's say it's Alejandra is your patient and she has her sticky spot and her goal is to, I apologize if I'm going to say this wrong, but
De-sticky
unstick
it.
it, unstick it. And it's 3 minutes a day. So in my mind, I was going to say, oh, she needs more pressure and it needs more massage daily. It's 3 minutes a day is the max. Does that just mean that you will do that daily until it starts to feel softer and the tissues no longer feel stuck? You just keep going until
Yeah, so you
it
so
feels
you
better, or
so you can keep going until it feels better. And the three techniques that I mentioned are kind of the starting points of where I start with a lot of my patients. But there are more
Mhm.
techniques that we can
Mm.
introduce and that we can do. One of them being, and this is when the scar is definitely further out, one of them being the use of silicone cups. So where we use silicone cups and I will actually apply coconut oil onto the scar. So this is for a person who doesn't have any hypersensitivity in the area,
Yeah.
as you can imagine. But I apply coconut oil onto the scar, and then I'm using my silicone cup, putting it onto the scar, applying a little squeeze so that I'm able to lift up the tissue. And when
Mhm.
I'm able to lift up the tissue with the silicone scar, I'm able to get to adhesions that are much deeper down than I possibly wouldn't be able to get to with my fingers. And then what I'm doing is while holding that pressure, I'm gently gliding that silicone cup to mobilize the tissue. It's such a great technique that I use with a lot of my patients, especially patients who have maybe had what we call a deep flap reconstruction surgery for breast cancer, where they take abdominal tissue to reconstruct the breast. They will have a lot more adhesions along that scar, which is a scar that's from your one hip bone to the other hip bone. So it's a pretty big scar. And that's a great technique because a lot of the times in that area, these adhesions are deeper down. And so we'll work
Right.
through it. Also, putting yourself in different positions sometimes physically can help
Mm,
you get to different parts of your scar. So, for example, patients who have this scar, the deep scar from hip to hip or C-section scar, a lot of the times you're better able to mobilize the tissue when the area is on slack. So what that means is it's easier to mobilize the tissue when their knees are bent versus if their knees were straight
mm-hmm.
because we have less pull of just all of the other tissues in the area and we're able to go a little bit deeper with our fingers. So so many different techniques, but three basic ones that I always show everyone.
Okay, I want to see your three basic techniques. I have
Yes.
to say something though that like I think so many, and we've been talking about this the whole conversation, but like so many of us forget is that a scar is more than just what you see on the surface of your skin, and we just even like I have to even remind myself of that as you're talking
Hmm.
about the silicone cups. Like it goes so deep, and that is why you feel pain and sensitivity, and tightness that feels like it can't go away.
I have the full like shelf. Yeah. Like my stomach, there is a line and an indent, and it's like the shelf. I don't know what they call it, but it is so visibly like sticky.
Stuck.
There's so much stuckness. I need your massage techniques. I need to go practice them
Yeah,
immediately.
and and that's the thing, people don't realize how a scar that's immobile can cause so many different other side effects, other complications, or other secondary things. And for example, a lot of my deep fat patients are people who have had C-sections. That scar can absolutely affect how your pelvic floor works, your digestion, how
Mm,
you breathe. And so when we forget that a scar is an important piece of the recovery puzzle, we're often missing something that can truly help someone get to the next point in their recovery. We're often missing something that's kind of the key to why they're experiencing X, Y, and Z. And so that's why looking at that scar and addressing the scar is so important in anyone's recovery.
yeah, it's just like music to my ears.
I
Okay,
know. I'm ready.
the three
I really
techniques.
want to see them.
Let's do it.
So when you're doing scar massage, I prefer, and most people prefer not to use any cream whatsoever. And the reason for that being is that you really want to be mobilizing the tissue instead of gliding over the skin. And so what that means is in my little hand for demo, if I have cream and I'm just gliding over the skin, that's doing nothing to those underlying tissues that we were talking about. But when I'm doing scar massage and I'm pushing into the skin and I'm mobilizing it, you're seeing how my skin is now moving, right? And so
Hmm.
the underlying layers of tissue are also moving. So that's what's essential for scar massage. We want to be mobilizing the tissues and not just gliding over our scar. Scar hydration, scar care is so important after you do the massage. That's when I tell people apply all your scar care products after your massage, but before no scar creams whatsoever.
Hmm.
So if you have a scar, I'll show you on my arm, it'll be easier. If you have a scar that's going down your arm, I should have drew one. Three techniques is you'll use two fingers and you'll gently apply pressure onto your scar. So it's enough pressure where you're pushing into the muscle, but it's not enough, again, like we talked about before, where it's uncomfortable. And then
Hmm.
what you're doing is while staying in that area, you're going to make circles. So you should see how your skin is moving instead of gliding over the skin, right? So big difference
Hmm.
between gliding and mobilizing. So you're making
Hmm.
circles in that one spot. Then you move slightly down your scar and do the same. Make circles. Direction of the circles doesn't matter. I get that question all the time. But think about maybe doing 10 to 15 in one spot. Then you move down the scar again and do your circles. So none of it should be painful, like I said. If you feel a slight zap, zing, any
Hmm.
of those funny things, it's totally normal, but not pain. So that's one technique, circles. The next is same thing. You're pushing into the scar and then you're doing side to side.
So
So
if the
again,
scar is like a vertical line,
a
I'm
vertical
going
line.
horizontal, not
Yeah.
like not with the line. I get
That
perpendicular to the line.
your head,
Yeah.
that's my third technique.
Okay.
So you're going side to side.
Okay. So like
Yeah.
crossroads. Okay.
And then same thing, you move down, do the same thing, move down, do the same thing. Then the third one is you're going in the direction of the scar. So
Okay.
parallel to the scar, on top of the scar. So the reason why you're doing all these different directions is, right, we live in a 3D world, so we want to make sure that we're able to move three-dimensionally. And so if our scar is not able to move three-dimensionally, then it'll limit some mobility. So we're really making sure that we're targeting it from all angles with the circles up and down and then side to side. Sometimes I add an additional technique. I'll show you guys. It's a fun one. So this is the pinch and lift. So I'll show you from the side. It'll be easier to see. So pinch and lift is you grab both ends of your scar. So you're on each end of your scar, and then you're pinching your scar and you're lifting it up slightly. So as you see, I'm lifting up a little bit. So pinch and lift.
So, like, if my scar is a straight line here, like
Yep.
a train track, I put
Yep.
my hand on each side of the train track or my finger, and then
Exactly.
I lift the train track up.
And then you pinch the train track and then you lift it up slightly.
Okay.
Yep. Exactly. So
So,
that really helps to mobilize a little bit of the tissues that are deeper down.
I'm just gonna like pretend you're my doctor right now. For some reason, these tiny movements, they give me like anxiety or something. Do you have, it's like there's something about like these tiny little movements that I don't know why. Like I could go run a couple blocks, but for some reason, sitting here and doing this gives me like a sense of anxiousness. Is that a thing that you have, or is it just me?
No, and that's exactly what we talked about. That relates back to that fear, back to that fight or flight. It's totally normal, right? This scar is not only physical, it has an emotional connection too. And a lot of people don't talk about that. So all of these fears, anxiety, whether it's I'm scared, it makes me nauseous. I hear that all of the time. I hear all kinds of things, and those are completely normal. Just your emotional response to the scar. And like I mentioned before, just starting to just touch the area, maybe just put a hand over the area and see how that feels.
Hmm.
And sometimes what I mentioned before is I'll have my patient put a hand over the area, but sometimes I'll integrate both. Hand over the area and let's do our box breathing. Let's calm our nervous
Mm-hmm.
system, tell our nervous system it's okay. I'm safe. No bear is chasing me,
Hmm.
right? So just working on these things, but that emotional aspect is so, so real.
Yeah.
That's really good. I was thinking, like, to get through this, even on my scar that's really old and doesn't hurt, like, I would have to incorporate some breathing because there's something about this, like, tiny little movement that I don't know gives me some anxiety. So I was like, could I do box breathing while I do it or like inhale, exhale on like every two swipes or whatever it is?
Yeah, totally. And if it's not box breathing, it can just be lengthened inhales and lengthened exhales. That also really helps to regulate our nervous system. Some people also find that, okay, it's way too emotional for me to do it. I'm going to have my partner do it. For some reason, that feels like a better starting
Mm,
place for me. And then once they see, okay, my partner's doing it, it's not opening up, it's not painful, it's not this, it's not that, that helps to reduce a lot of the fear and really tell your body, this is safe, we can work through it. But again, I think really respecting what your body is telling you and how you feel is so, so important. And working at that place first is really the best place to start.
Liken this a lot to, I mean, of course, you're a physical therapist, but like going to the gym or going to a trainer where you go the first time and it's so intimidating to lift weights or try new machines that you've never
Hmm.
seen before. But the more you practice and the more you change that association of like, I can't do this to, oh, I can, and I can push through, and then I'm actually really good at this. You can train your body and your mind to get better with that discomfort.
mhm.
I
Yeah,
don't know, I just always
definitely.
think of it as like working out at the gym. You have to work your scar in the same way. It's a different type of exercise, but at first it really hurts and it's hard, but
Yeah,
it pays off.
definitely.
Mhm.
Okay, so we have our 3 techniques. This is amazing.
Thank you.
And I know you covered this a little bit, but I wanted to, if there's any more that you have on this, is for those of us that do feel anxious about this and are tempted to not do scar mobility exercises or techniques or therapies. How does it affect your overall healing if you're not doing proper scar mobility? If your scar is still tight and you have adhesions, you said that it can affect your digestion, it can affect your breathing. These are big things. This isn't just your skin feeling tight. Digestion issues, that's going to affect everything in your body. So can you expand a little bit on that more, just so we understand the importance of this?
Yeah, so I mean, like I said before, if your scar is not moving, it can create secondary issues in that local area, right? Of course. So, depending on where that scar is in the body, it can create a lot of secondary issues local to the area, whether that be because of that tightness of the scar anchoring things down. So, a lot of times, what I see, especially for my breast cancer patients, is that poor scar mobility is actually what's limiting their ability to lift overhead, reach overhead. That scar mobility is causing so much tightness of the chest that it's actually limiting their ability to breathe properly. So it's limiting their rib cage mobility. It's also causing them to be in an altered posture where they're being brought forward because the scar is pulling, which is changing the complete biodynamics of the shoulder joint, how our upper back moves, how our shoulder blade moves. And those postural changes can lead to secondary compensations where we're now compensating so much that we develop upper back pain or lower back pain or neck pain. And then, same thing for people who have had lower body scars, and we're looking more at how is that scar affecting their digestion? How is that scar affecting their diaphragm movement, which is so importantly linked to the pelvic floor and bowel and bladder function? So when we're not addressing that scar, like I mentioned before, we're missing a big part of the healing. And that scar can potentially cause issues with comfort, how you move, and how you go about your day to day. So really, it's so important that we work on that scar. Like I keep saying, it's often a missing piece that we forget to work on in healing.
Yeah, it feels like everyone that undergoes or gets a scar for any reason, but they should have a scar evaluation 4 weeks after, just to see if you're feeling things, if digestion isn't working, could it be because of the scar? And no one's put that together.
No, exactly. No one's put that together, and it's really interesting. I mean, people have extensive scars, right? Whether it's traumatic or non-traumatic surgeries, but those scars can significantly limit your mobility, your ability to move comfortably in your day to day. Just imagine someone who has this deep scar or a more extensive breast scar that can absolutely change their posture and then limit how they're able to move about in their day to day. And if no one's addressing it, it's crazy that no one is.
Yeah. Yeah.
Mhm.
And then I would imagine you start doing things that you think are gonna help your back because you think you have a sore back, but it's not helping, and it's because you're not addressing the real problem. This has been an incredible conversation. As we close out, we usually like to leave our listeners, I mean, this whole conversation just has been a gift, but we like to leave our listeners with a little something. And what I'd love to ask of you today, Amanda, is if we have someone that's listening and they're about to have surgery or they just got out of surgery or they want to look into scar mobilization and scar therapy and physical therapy, how can they find someone that they can go to? How do they reach out to you? Do you have a network or a database that they can go to? How can they get this type of treatment and therapy?
Yeah, it's such a good question. So, like I mentioned before, especially in the breast cancer world, physical therapy, occupational therapy is not well known whatsoever. So, if you are looking for someone within your community and you need help finding someone, please do not hesitate to message me on Instagram or send me an email. I'm always super happy connecting people with local therapists or local specialized therapists. But also, another good way of finding a breast cancer rehab therapist specifically is go on Google, type those exact words: breast cancer rehabilitation near put your city. Sometimes this is the best way of finding someone by using those really specific words, their specialization. And this will ensure that you're working with someone who really understands how to safely work with you after these types of surgeries and will be able to really look at what you need and then safely progress you through the scar desensitization and scar massage. But like I said, also I'm super happy to help people connect with therapists locally. So please don't hesitate to reach out to me either.
It's amazing. Thank you. What is your handle so people can find you on Instagram?
Yes, it's the breast cancer PT.
So the breast cancer PT. And then is your email available on there, or do you have a website that they can go to for your email? Perfect. So you can
All
find
there.
her email there. Feel free to reach out. Amanda's a wealth of knowledge. And we're just so thankful for this conversation. Thank you for joining us. Thank you for being part of the Estes community. Thank you for all that you do. You are helping so many women in an area that clearly needs attention. And thank you for sharing your techniques with us. We're super
Yeah.
grateful.
Thank you so, so
Absolutely.
much.
Thank you so much for having me. It's been so much fun.